Hi guys, welcome to my YouTube channel. If this is your first time seeing my face, welcome to my YouTube channel. If you're a returning subscriber, thank you guys for coming back. My name is Pretty Pin and I'm a student nurse in the UK and I'm currently studying nursing. I do videos about my life in the UK, nursing and other vlog. So in today's video, I'll be talking about how to fill your RPL form for MSc Nursing Registration nursing students who are currently applying for nursing. RPL form means recognition of prior learning. So today I'll be teaching you guys, I'll be giving you guys tips on how to fill this form. This video was because somebody on my comment section or people already chatted me up on Instagram asking me to tell them how to fill this form. There's no straight way of filling this form, but I'll be giving you my general view and how it's going to help you to fill your own form, because every university have their own format, their own style. I know most students that they've sent their RPL form to me, and trust me, I don't want to say anything, but it looks like, a full-time coursework. But I'll be giving you guys the tips. One thing I know is that all of them have the same thing in common. They just want a particular thing for you. So if this kind of video you want, sit back, relax, and let's get right into today's video. So in today's video, I'll be talking about how to fill your RPL form. As I said before, RPL means recognition of prior learning. One thing you should bear in mind is that before you go into nursing, I will always try to let you know that there's something you must have in mind. Even if, for example, you apply, you got a slot for interview, you finished your interview, after your interview, you move to the next stage, you're cleared up, and it's time for RPL. Trust me, if you fuck your RPL form, you will not even get the offer. So I feel like even if you cross all bridges, the last one is the RPL, and that has like the most important one. This is for people who wants to study MSc, which is become a registered nurse under NMC in 2 years. So let's take this very serious. Let's take it very serious. So one thing you should bear in mind is that your RPL folder or your RPL documents, it's what they call your portfolio evidence. It's like your evidence of practice or your evidence of learning. So you need to do your best. You need to do your best, because I know most people who were not able to do the RPL and they were not able to get into school even after meeting up every other credentials or every other things they are supposed to meet, but just this RPL, this is like the firefighter. So take it serious. So I'll start by talking about the RPL portfolio example structure. This is something you get to see in every RPL this thing, their structure, how they want it to be. One thing you should bear in mind is in an RPL document or in an RPL folder or in an RPL file, something you should bear in mind they want to see is, one, there's something they call table of content, and under the table of contents they will have like your section 1, which has to do your evidence-based practice or your job description. Section 2 is always about like your main RPL file document, where you tend to talk about your platform, your proficiency, and things you need to do. Then the section 3 most time used to be about episode of care, like how you have delivered care to people. And then most time the last episode used to be what I call medicine management, like how you've done medication, or they ask few questions over there, like normal questions. So something you should bear in mind is that when you're doing your RPL document, have a structure. It's very important. Under that structure, there's something they want to be saying. They want to know how good your academic skill is. Trust me, because you're applying for MSc, and that MSc is level 7. So they want to see how your academic skill is. Like, how do you write? Do you write like a level 7 student? They want to see all those things. So you need to be very careful, like very, very careful when writing. Look for someone to proofread your work. It's very, very important before you submit, or someone to guide you. Like, I know I've helped most people, like I've guided them, but I can't guide everybody, and I cannot, help everybody at the same time because I have other things I'm doing. So always have a structure. I mean, when you see your RPA document, have a structure. Always have a structure, because definitely it's going to come with table of content. It's going with, just in mind, try to summarize what you, just summarize the things you've done on a different paperwork, like not on your RPA. Just summarize what you've done on a different paperwork, so you know the things that you'll be bringing to the table when you see your RPL form. Summarize your paperwork, your job experience and all that. Like, try to create a structure for yourself first. Get your structure down, so that when you see your RPL form, it's easy for you to just narrow it down. I don't know whether you understand what I'm saying. So another thing I'll try to talk about is choosing your evidence base. Like, you having a structure is one. I'm saying all these things, like things you should put in place before you start your RPL documents. So have a structure. And the next thing is choose an evidence base. So when choosing an evidence base, something you should, if you're writing about something, please let it be authentic. And another thing I think you should do is try to put something very current, your current work experience. Something you've done on, like something you've done this current time. It's very, very important. And when choosing a particular evidence-based scenario, try to choose something that is relevant. I don't know if you understand what I'm saying. Something that is very relevant, like something that you can link to your learning outcome, something that you can link to your learning module. Because trust me, before they give you this RPL, you've already seen your learning module online in your school website. So you have to, when you're writing whatever you want to write as your evidence based, or you're writing a story or a care plan, let it link to your learning outcome. I've seen some RPL form that I'm wondering, like they've already stated the learning outcome for them. So one thing you should always do is read your learning outcome first, then read your question, then know what, and make sure there's a link within your evidence based down to your learning outcome. So we've talked about two things. One is having a structure. Two is choosing a proper evidence, like evidence-based practice that suits you, that is authentic, that is reliable. So we've talked about two parts now. Next thing is reflecting on your experience. That is really, really important. You really need to reflect on your experience. Like, when it's something that, because if you see what I'm trying to say, everything from structure down to choosing an evidence down to reflecting. If you don't choose a proper evidence that suits the things you've done, how do you want to reflect on it? I don't know whether you understand the link. You have to have a structure. Then having a structure, you have to choose something you've done before, something you've practiced, and evidence that you've come across. That's how you'll be able to choose something that you can reflect on. Do you understand? So the three things, that's how I tell people, these three things are the most important thing you should know when filling your RPL form, or you should structure. Like right now, and I know that okay, you've gotten your admission, blah blah blah, for next year. Just sit down, start structuring these things yourself before you get to see your RPL. Just structure them, write it down, just do the whole thing. It makes your work easy. So once it comes, you start knowing where to put each and everything. And when reflecting on an experience, please make sure you make good use of your academic writing. It's very important in that reflection, because it might tell you to do a reflection about your experience. So doing a reflection about your experience, you have to use reflection model, which is like Gibbs, Driscoll. Just read about it. Most university will not tell you, while some will tell you. But please make sure that when they ask you to reflect on any events that have happened in your life, or you treating a patient, make sure you use the reflective model. I know there is most people use Gibbs, and there is Driscoll, and I think when I was doing I used Gibbs because it's straightforward. But now that I'm an MSc student, now that I am into the course, I use Driscoll mostly, because Driscoll will help me with, I think it helps my academic style properly, like my academic writing. I'm very comfortable with it. All my reflection I've done, for about how many months now, I'm very comfortable with Driscoll. So I think you should just read about the reflective style and know the one that suits you and the one you can write comfortable with, and that can make you reflect well. And then please make sure you bear in mind that you're writing in as a level 7 student or as a level 7 student in view. So make sure that your academic writing, your academic skill is on point. It's very important. So guys, I'm done with the tips and tricks of how to fill your RPL or how to prepare for your RPL document, or how to write your RPL document. Next, I'll be talking about how to get the relevant experience you need. Why I'm saying this is because I saw a comment, somebody telling me, how can I how can I not have a background and then I'll have to fill the RPL document. I saw that on my last comment section on the last video. I think 2 videos I did. I can't remember. I think 2 videos I did. So what I'll be saying is that trust me, you can get the experience you need. You don't have to study nursing in your first degree. You don't have to study microbiology. You don't have to study any. Just shall have 2-1 or 2-2. Do you understand? Have 2-1 or 2-2. If you know you want to study nursing, give yourself 1 year. Go and work in the laboratory, go and work in primary care center, go and work in the hospital, do a voluntary service. NGO, do a voluntary service. Is very important. For those in the UK, I'm sure it's very easy for you guys, because definitely most students in the UK are into healthcare, so they know basic things. They've definitely covered the hours, the hours that is expected. So for those of you that are in Nigeria, Ghana, Zimbabwe, Malawi, Kenya, Sierra Leone, and the rest, Cameroon, and you want to come to the UK, and your degree, your first degree, you don't have any experience, it's not health related, don't worry. Do you understand? Most schools say they need work experience of 600 and something to 900 hours. Just tell yourself, go and apply in a hospital. Like, tell them, I want to apply, I want to do a voluntary service as an auxiliary nurse. I just want to work with you guys. I don't need your money. I know it's difficult, but trust me, when you want something, you have to sacrifice. I don't know that you get me. You have to sacrifice. Like me, self, if I want something, even here in the UK, I have to sacrifice for it. I don't know if you get me. Let me give an example now. For example, you want to work in one particular hospital, like maybe as a student nurse, you want to work in a very big hospital in London. Trust me, and you've not worked there before, you've not even schooled in London before, and you're coming from a different place. And we used to have something they call elective placement towards our last year in uni, where you have to pick where you have to pick your place of placement. You can just go to that place and just go and do your last placement there. Trust me, you will definitely get the job if you do well. So it's sacrifice. I don't know if you understand me. It's sacrifice. So there's some sacrifice you just have to pay. You don't need, just tell them you don't need the money, work. Even if it's 2 months you're spending there, you go to NGO, you do another 1 month, you go to maybe laboratory, lab, you do another 1 month, you go to immunization center, you don't just learn those basic things. So you get to see people, you get to work with nurses, you get to work with matron, you get to work with doctors, you get to work with different people, so that when it's time for them to sign your RPL form, it's going to be easy. When it's time for you to get reference, it's going to be easy. I don't know if you see the link of what I'm saying. So 1 is getting the admission, 2 is getting all the necessary things you need. And if you don't get all this experience, there's no how you will fill all those forms with confidence. So at this junction, I think I have been able to talk about how to fill your RPL form like properly. So in summary, I'll now be giving you a straight, because practically I've told you the first one, which is going to help you develop your structure, pick out a very good evidence, and then reflect on it. And now I linked it on how you'll be able to get the relevant work experience. So now I'm not going to be summarizing it by telling you how to present it to the uni, like how to package your documents, like your portfolio. Because trust me, I have struggled for the past couple of months. People throwing portfolio at me as if I am the school. Oh, just I can't do this. Oh, please help me. Oh, I don't understand what to do. Oh God, it's a bit tiring on my side too, because I have school to deal with and other things. So I also have work. When I see people say, "Oh, I don't know how to feel this," I keep explaining and saying, "Oh, you need to package it this way," and I'm going to still argue with you saying, "Oh, no, no." And me, I'm really a patient person. It kind of, so when I see you want to argue, I'll be like, I'll tell you this for the last time, and if you don't listen, I'm not going to open this chapter again. And trust me, if you fail and you lose the admission, don't come for me. But thank God, Holy Spirit used to just shout, touch them. Because me, when I say something, I say it straight. I'm so blunt that when I am fed up of telling you something and you're not listening, and I just say it blunt, I know it touches them. Because trust me, I got no filter. I just say it as it is. Because trust me, I'm going to school and then I'm coming back. I'm resting, and then I'm also going to work, and I've got reflection and all that, and I still have you to deal with. Like, it's crazy. If you're not doing this, don't disturb me. And I think it hits them differently, and they try to make amendments, and they're like, okay, I'll do it this way. And trust me, I've got up to 4 people to 5 people that have gotten admission into nursing. Maybe they submit immediately. They don't even stay up to 3 days, 4 days. It comes out successfully. They'll be so happy. They will be jumping. And then I start telling them that, do you know, all the time I've been telling you, do this, you're arguing with me. These people, there's something they need from you. So we that are already in the field, like, we're already there, we already know, we've experienced acting, we've made those mistakes. So we don't want people following us to make that mistake too. In Davido's voice, we rise by lifting others. So just follow these tips, and let me go back to my normal topic. So now I'll be summarizing the whole thing now, how to package your RPL documents. So in your table of content, the first thing you get to see is your evidence based, which is your portfolio, your section 1. Under there, no matter anything they ask you to write it. But please don't forget to put a very detailed CV, a very detailed job description, a very detailed experience with so much references. Let your academic skill be on point. A very detailed appraisers from your manager, even if it's 1, even if it's 2, and all your trainings. They must be in your section 1. It's very, very important. I don't know whether you understand how I've listed all of them. I can't repeat myself again. So just arrange all of them. They should be in your section 1. Don't start saying, why they did not ask me for my CV. Your CV is your everything. Your CV is your everything, because if they ask you your job description, what you've done, your experience, and you write all your experience, and it doesn't, if you use your CV to back it up, do you know what it means? They said what they see is what they will record for you. What they did not see, it didn't happen. Section 2 is where you have to see all the platforms and proficiency, where they ask you, have you been able to achieve assessing care and planning care? Have you been able to achieve promoting and preventing ill health? Have you been able to achieve evaluating care and all that? Sometimes they'll ask you to write on one proficiency and how you've achieved it. Sometimes they'll just write all of them with different proficiency and tell you whether you've achieved it or not, and then they'll ask a registered nurse that you've worked with or a doctor to sign you off. So it depends. It can be tricky. So it depends. Sometimes it's just for them to sign you off. Most times for people who are already in the UK, but people who are in Nigeria, they want you to do lots of explanation, lots of academic writing. So you need to package those things properly. It's very important. The next section is the section 3, which most likely is always episode of care. How have you been able to evaluate care? Have you been able to deliver care? And sometimes under this episode of care, they might ask you to generate a care plan. Just write a care plan. So you need to learn all those things. It's very important. You use a care plan to back it up. And then the last section is always medication management. Some schools don't do the medication management, while some schools always ask for the medication management. Definitely, you might have not come in contact with medication, or if you do like a volunteer work, you definitely come in contact with medication. But you just need a nurse or a doctor to just sit you down and talk through all the medication proficiency that you need to know. Since you need to check before giving out medication to a patient, and checking their names, making sure it's the right person, making sure you're giving the right dose and all those necessary things. You have to just and then they'll have to sign you. It's very important. And lastly, I skipped when I was talking about the section 1, which is your evidence based. It's your the hours you've worked, the hours they want you to meet up. That's why you need all those basic experience that they ask you. So all those basic experience, you have to draft a timesheet stating how you've achieved those hours, and then a doctor or a nurse will sign you off. So practically, I will be leaving the link of should I say a timesheet of how to draft your own timesheet or print your own timesheet, or you can even ask me privately on Instagram. And then, in case I did not put it, because definitely I might even forget. If I did not put it, you can ask me on Instagram and I'll send it to you. Definitely, I send those things out because they are blank timesheet. It doesn't carry any school names, so you just print it out and then do it your own way. At this point, I've come to the end of this video. I hope you guys enjoyed this video. I hope you guys understand this video because I took my time to explain it properly. So guys, do not forget to share. Guys, let's get this video to these subscribers to 1,000. Please guys, if you're enjoying this video, share. Tell your family member to subscribe. Tell your auntie, your uncle, everybody know that wants to come to the UK to subscribe. So this video, I'll be thanking somebody who has been very helpful with people on YouTube, people who come to me on YouTube. Edu Severius, thank you so much. He's always helpful, trust me. He makes sure he attends to all of them. He has been helpful. And guys, I would like to say Edu is a educational consultant that helps students migrate from African countries to UK, US, and any other country you want to migrate to. And trust me, it's free, no money is in charge, and he advises you on the course. All you have to do is to chat him up and tell him you are from Pretty Pen. Trust me, if you do that, he's going to give you all the attention you need because he is my G, and we've got lots of people coming into the UK to study this September. I can't wait to go and pick some of them at the airport. So I'm just going to check my schedule whether I have my OSCE exam then. But trust me, I will do that. So guys, do not forget to like, share, comment, subscribe, and I'll see you guys in my next video. I remain your humble girl, aka Pretty Pin, aka Baby Girl for Life, aka should I add a new one? Let me add a new one, aka Adanaya. So guys, bye.